Welcome to our comprehensive guide on mental disorders. You know, folks, we spend so much time focusing on our physical health, eating right, exercising, going to the doctor, but what about our mental well-being? It's just as important, and sometimes even more so, because it affects every single aspect of our lives. We're going to take a deep dive into the different types of mental disorders, from the ones we hear about all the time to those that might be less familiar. We'll break down the symptoms, the causes, and most importantly, what you can do about it. Because let's be real, mental health issues don't discriminate. They can affect anyone, regardless of age, gender, race, or socioeconomic status. And the more we understand these conditions, the better equipped we are to support ourselves and the people we care about. Anxiety disorders, when fear takes control. We're talking constant worry, panic attacks that feel like heart attacks, the dread of social situations, and those intrusive thoughts you just can't shake. Mood disorders, riding the emotional roller coaster. From deep sadness that lingers for weeks to extreme highs and lows that disrupt your life, mood disorders impact how you feel and function. Psychotic disorders, losing touch with reality. Hallucinations, delusions, and disorganized thinking. Psychotic disorders can make it difficult to distinguish what's real from what's not. Personality disorders, patterns of troubled thinking and behavior. These disorders involve inflexible personality traits that cause significant distress in relationships, work, and overall well-being. Borderline personality disorder, narcissistic personality disorder. Trauma and stressor-related disorders, the aftermath of trauma. Experiencing a traumatic event can leave lasting scars. We'll explore the emotional and behavioral impacts of trauma. Eating disorders, a complicated relationship with food. Eating disorders are serious mental illnesses characterized by an unhealthy obsession with food, weight, and body image. Anorexia nervosa, bulimia nervosa, binge eating disorder. These disorders, often present in childhood, impact learning, communication, and behavior. We'll discuss autism, ADHD, and more. Dissociative disorders involve disruptions in memory, identity, and awareness. It's like your sense of self is fragmented. These disorders involve experiencing physical symptoms that are amplified by psychological factors like stress and anxiety. Substance-related and addictive disorders, the grip of addiction. We'll delve into the complexities of addiction, from the biological and psychological factors to the impact on individuals and families. Sleep-wake disorders, the importance of rest. From insomnia to sleep apnea, we'll explore the disorders that rob you of restful sleep and impact your daily life. Sexual dysfunctions. When intimacy is difficult, we're tackling a sensitive topic, sexual dysfunctions, and discussing the various forms they can take and the available treatments. Disruptive impulse control and conduct disorders. Challenging behaviors. These disorders involve problems with self-control, often manifesting as defiant, aggressive, or destructive behaviors. Neurocognitive disorders, affecting thinking and memory. We'll explore conditions like Alzheimer's disease and dementia, which affect cognitive abilities like memory, thinking, and language. Other mental disorders, a broad spectrum. This category encompasses a range of conditions, including gender dysphoria, paraphilic disorders, and factitious disorder. Seeking help and finding support. Look, recognizing that there's a problem is the first step. It's like anything else in life, folks. You've got to identify the issue before you can fix it. Mental health is just as important as physical health. If you're struggling, you need to reach out for help. Talk to your doctor, a therapist, a counselor. There are resources out there. And if you know someone who's going through a tough time, be there for them, offer support, and encourage them to get the help they need. Remember, you're not alone in this. There's no shame in asking for help, and there's strength in taking that first step towards recovery.